Hello again, and welcome to PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis.
I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX.
On today's show, we're talking about something that's been quietly protecting teeth for decades and sparking a few conspiracy theories along the way, and that would be fluoride.
And fluoride has an interesting backstory. It was first introduced into the public water supplies in the United States back in the 1940s after researchers noticed that people in areas with naturally fluorinated water had fewer cavities in their teeth or dental caries. The CDC has since named community water fluoridation as one of the top 10 public health achievements of the 20th century.
Despite that, it hasn't always been smooth sailing. From the start, some folks were skeptical. There were Cold War-era rumors that fluoridation was a communist mind control plot.
Wow.
Fast forward to today, and the concerns have shifted, but controversy still lingers in some communities.
That brings us to a big headline this month. On April 29th, 2025, Florida lawmakers passed a bill that will effectively ban the addition of fluoride to public drinking water across the state. The measure, tucked into a broader farm bill, doesn't mention fluoride by name, but it prohibits adding any substance to water that are intended to treat or prevent disease.
Which, of course, would include fluoride. And the idea, according to the bill's supporters, is about individual liberty. They argue that people shouldn't be medicated through their tap water without explicit consent.
But public health experts and dental associations are worried. The American Dental Association and the CDC have warned that removing fluoride could reverse decades of progress in preventing tooth decay, especially for underserved populations that don't have easy access to regular dental care.
Right. Dental fluorosis is usually diagnosed during a dental exam. X-rays are taken and bone scans are used if doctors suspect skeletal fluorosis. Again, this is extremely rare in areas with regulated fluoride levels.
And it's important to remember that fluorinated drinking water is carefully monitored, and the EPA sets the maximum safe limit at 4.0 milligrams per liter. And most systems aim for much lower inclusion, much lower, around 0.7 millimeters per liter to balance the benefits and the risks. And I don't know if we're going to mention this, but in Canada, and I think it's Winnipeg, and I'm sorry, Canadians, if I am using the wrong location. 10 years ago, they banned fluoride in the water.
Oh.
And they saw a 15% increase in dental caries, and it was in children. Because, and so they have now put fluoride back in their water because they're trying to undo that harm.
Maybe they did it in Florida first because so many people don't have teeth anyway.
Wow.
Unfortunately, I think
so
if we delve more into this, we're going to
please direct your emails to Lita.
I think if we delve more into politics of this,
right,
it could get a little bit
heated. But
down a rabbit hole we don't want to go down to.
I will say, when we moved, so we do not have fluoride in our water because we have well water. And since we've had well water, our dental caries spiked. And before, I had perfect teeth, no problems. Now I'm visiting the dentist every 4 months. And like I said, they saw a 15% increase. That's really significant. And it's for children. And okay, I'm sorry.
Yeah.
Okay. Go ahead, Mom.
If fluoride exposure is excessive over long periods, complications can include dental discoloration, joint pain, stiffness, and bone fractures in extreme cases.
And you can look up pictures of this. I mean, their teeth are brown, so you would know we're not all walking around with brown teeth.
Right.
I mean,
We're
like
not
very
overly. We're not
no,
overly.
no. I mean, like
fluoridated.
really brown,
Right.
not like smoker's brown. Really brown. It stains the teeth.
Right. But listen, these issues that we're talking about, they're very rare in developed countries,
Right.
okay, where fluoride use is monitored and also regulated.
Right. So unless you are drinking from a naturally
Right.
fluorinated source that's heavy in fluorination, or like dousing it by the gallon, you're probably safe. And your dentist is your friend here, people.
Right. Mild dental fluorosis doesn't usually require treatment. And if it does, it's mostly cosmetic.
Right.
However, severe dental fluorosis can sometimes be treated with veneers or bonding if someone wants to improve the appearance of their teeth.
Yeah. Again, it's brown staining. Skeletal fluorosis, on the other hand, would require eliminating excess fluoride exposure and managing symptoms under a doctor's care. But luckily, catching it is usually, prevents it from progressing.
So the best prevention would be moderation.
Right.
Use fluoride toothpaste, but teach kids to use it like a pea-sized amount,
Mhm.
and definitely don't swallow it.
And
Brush your teeth and spit it out.
right.
Mhm.
And drinking fluorinated tap water, but don't start blending, fluoride smoothies or, straight fluoride or anything like that.
Do people have access to purchase fluoride?
I don't know. You can. Oh, okay. I was gonna say you would be
Anyway.
shocked at what you can purchase
Yeah.
online.
And you should know your local water supply. If you live in an area with naturally high fluoride levels, some households install water filters to stay within safe limits.
And also get regular dental checkups. Those are important because they can catch early signs of overexposure or just to help you keep your pearly whites bright.
And looking ahead, fluoride will continue to play a major role in fighting tooth decay, especially as researchers look for ways to target delivery, like fluoride varnishes and sealants when you're at the dentist, but you have to go to the dentist to get those. But those can deliver benefits without affecting your whole body.
Because they apply it topically.
Right. Okay.
And public health officials continue to monitor levels carefully because we want healthy teeth, not bone problems.
And it's not like you hear about fluorosis of the skeleton all that often. Or am I missing something?
No,
Okay.
I don't hear about it.
I've
often.
never heard of it before.
So
Mm-hmm.
the next time you take a sip of your tap water,
Mhm.
remember to give a little nod to the invisible superhero keeping those cavities at bay.
And here's something else worth noting. Opponents to fluoridation often cite a 2019 federal study that suggested that high fluoride levels during pregnancy might affect the IQ of the unborn child. Or the child's IQ. But even that study didn't conclude that fluorinated water in the U.S. posed a danger. The levels studied were often much higher than the recommended 0.7 milligrams per liter.
That's right. And several follow-up studies have found that when fluoride levels are kept within regulated limits, the benefits far outweigh any potential risk.
Right. But the Florida decision could still set a precedent. So other states may wind up following suit, especially those where political opposition to perceived quote unquote government overreach is strong. So this may be the beginning of a broader national conversation.
And a much bigger problem with dental caries. So if you're going to be starting college soon, you might want to go into dental because there's going to be a greater need.
Yep.
And while debates about liberty and bodily autonomy are important, they need to be balanced with community health outcomes. Oral health, after all, affects everything: your self-esteem, your ability to speak, nutrition, and even though, now we know your heart health is linked to your dental health.
Yes. And it's also worth mentioning that communities that have discontinued water fluoridation have often seen a rise in cavities, especially among children.
So I bet you're asking yourself,
Yeah.
what can I do as a listener? Well, check your water supply quality report. You can usually find it. It should be available through your city's website or public works department. And also talk to your dentist about fluoride treatments that are best for your family's specific needs.
And keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
And thank you for listening to this episode of PodcastDX. Stay healthy and maybe brush and floss your teeth while you're at it.
Till next week, keep smiling.